So my name's Anna. I work at Impact on Urban Health, and I'm going to be talking to you today about the Urban Health Index, which we've recently developed and published. So just to quickly go through the agenda today, I'm going to give a very brief overview of the work that, and then talk to you today mostly about what is the Urban Health Index, why did we develop it, and how did we go about it. And then I'll give you a very brief demo of the tool, the index. And then hopefully Alessandra will be joined by then to talk to you a bit about some of the initial analysis that we've done so far. And then I'll just briefly talk about what's next, how we plan on using this, and we'll have time for questions at the end. I will say, if you have questions as we go through, please feel free to put them in the question chat, and then we'll circle back and try to answer it as possible at the end of the session. So, as I said, Alessandra and I both work at Impact on Urban Health. It's part of Guy's and St. Thomas's Foundation. So we're a place-based urban health foundation with a focus on improving health in inner city areas, and we work particularly in Lambeth and Southwark in South London. So health is impacted hugely by our environments in which we live and other social factors. So as an organization, we're really at the forefront of trying to understand and change how inequalities impact our health. So what do we know? So we believe that where we grow up, where we live and spend our time, and where we work have huge impacts on our health, and that urban areas have some of the most extreme health outcomes that we see across the country. So our aim is really to tackle these complex health issues that are disproportionately impacting people that live in urban areas. So we work particularly on 4 programs, which are health effects of air pollution, obesity, adolescent mental health, and multiple long-term conditions. Build our understanding of how cities can be shaped to support better health. So what is Urban Health Index? So the Urban Health Index is based on the Social Progress Index, and that was developed in 2014 by an organization called the Social Progress Imperative. And they developed a methodology and created a global SPI. So they've calculated a social progress index score for almost every country where they had data available. Since been updating that each year to really track progress over time. And the idea is that while countries are generally measured based on economic indicators, so we see GDP often, there's really so much more that should be considered, and that's at play here. So the SPI is an aggregate measure that captures roughly 3 dimensions, so basic needs, foundations of well-being, and opportunity. Sit as a complementary index to the traditional economic indicators, which really allows social progress to meaningfully be benchmarked against peers in similar areas. And since the global SPI was developed, Social Progress Imperative have with organizations, governments, companies around the world to develop smaller, more localized social progress indexes. What we've kind of done with them, and thus creating the Urban Health Index in Lambeth and Southwark. So the framework, as I mentioned, there are dimensions, and within those there are 12 components. So you can see we've got nutrition and basic medical care, or health and wellness. But then within each of those components, we were able to have a lot of in which indicators we wanted to use for Lambeth and Southwark. And that's really the building blocks of what creates the final SPI, Urban Health Index score. And those are things that will be relevant in your areas and were really relevant to us in our work that we did. So why did we do this? Why did we think it was important? So as I mentioned before, our aim as a foundation is to really understand the deep causes of complex health issues and to explore different ways of addressing them through combining different sources of data and collecting lots of robust evidence, as well as lived experience, of course. And this index really lists data in a way that will build a better picture of the circumstances people live in urban areas, and to understand and how they impact their health. We also thought, this will be a tool for other stakeholders and our partners and other people working in Lambeth and Southwark to really facilitate identifying opportunities and being able to improve the environments in which people are living. A resource to really understand which areas are in most need of resources, and to be able to tailor our projects to fit the needs of specific areas. So how did we do this? So we've been working pretty much over the past year with Social Progress Imperative. And I guess there are roughly 5 main steps that we went through to develop the final tool. And I'll quickly go through each of them, but I would encourage you, we'll put in the chat a link to the page to our Social Progress Index, and there's a methodology report. So if you are interested, please do go check that out as well for more details. So we started by creating so I think we came up with something like 200, a bit more indicators, everything we could think of that we might want to include in this tool. And then that was shortened and prioritized through several rounds. And that was based on a number of different criteria. Some of those criteria are here, but it couldn't be an economic indicator. It had to be an outcome. It had to be available at the geographic level that we were looking at, which is MSOA level. Other criteria as well. And we came up with 42 indicators in the final index. And I should mention that of those 42, 39 of them we took from OCSI site. So a little plug for them. It's a fantastic tool that we use every day that brings together open source and up-to-date from across England, and they have it at MSOA. So once we had the data, we had to check for missingness. One of our criteria were that it didn't use indicators that had lots of missing values. So we were able to avoid most missing indicators, most missing values rather, but we did have 2. So for 2 MSOAs within the vacant, there were missing values. And what we did was we took the surrounding 4 MSOAs, we averaged their scores, and we used that for those values. And then there were a number of different ways that we transformed the data. So firstly, if an indicator was did not display a normal distribution, what we did not confined either the upper or the lower boundary. If indicator was not available at MSOA level, so if it was at LSOA level, we aggregated to MSOA level. And finally, across all the indicators, we standardized them so that they could be comparable. And then the last 2 steps, I will say our partners really drove most of the work in these 2 steps. And that was aggregating and scaling. We used several statistical methods to build the components and the dimensions and the overall index. number of statistical methods. And then the indicators were tested using several statistical methods to check that they actually conceptually fit together within each component. So again, for more information on all of these steps, but particularly if you're interested in some of these more technical bits, please do check out the methodology report. So moving to the scorecard. So I'll give you a quick demo. The version that we published, I will say, is slightly different. And we just added to it recently, but we want to publish this newer version, and we're planning to do that very soon. So the original version is just this main scorecard, but on the right-hand side, this map here, so that you really see the spread of scores across the area, so of Lambeth and so you've got your overall score, which is out of 100 up at the top. You've got its rank out of the 68 MSOAs. You've got the name. Then we've done a really simple traffic light system. So the top 20 ranked MSOAs, the bottom have red and the middle have yellow. Here we've got our 3 dimensions. We've got our 12 components, and then within those we have our indicators that make up the final score. So you can really delve into the detail that you want, but you can also stay pretty high level. If you want the view on the map, you can look specifically one dimension or one component or one indicator, and that will change the view that you see here, and you can get a different layout there. Similarly, if you want to change, right now it's on the traffic light performance indicator view, but you can, if you want a little bit more granularity, to see the scaled version here. And if you know exactly what you're interested in and you want to choose, you're able to MSOA that way as well. So there's a lot going on. There's a lot of information, but we feel it's easy to use, easy to navigate way to see all that information in one kind of easy to use tool. So that's the scorecard. I'm gonna see if Alessandra is back. Hopefully.
I'm here, Anna. Can you see me now? Oh, great, thank you. Shall I start sharing my screen?
Yes.
Sorry, just to check with you, Anna, can you see my screen now?
No.
No. Okay, 1 second. We'll get there. It's not happening, is it?
Do you want me to share and you can walk through it?
I think yes, if you can, please, and I'll tell you when to change. Okay, perfect.
Yep.
Okay. Okay, perfect. Hi everyone, I'm Alessandra, and I've been working with Anna and then the data team to the Urban Health Index scorecard and analysis. As you can see, and Anna showed you, the scorecard allows us to layer different social and environmental indicators to understand our neighborhoods and to actually have a better picture of the circumstances of people living in urban areas and how the environment impacts their health. One of the first things we'd ask ourselves was, the scorecard is telling us a story of a neighborhood, but can we actually identify the areas that share common outcomes? What are the most common outcomes that exist together in the same areas? So the first analysis we did was just running some correlation and to see relationship between indicators that we use for our urban health index. The measures that were mostly related were these three that you can see on screen now. So adult skill and English language proficiency, which is the proportion of adults that have they cannot speak English or don't have a good level of English and have low qualification. Then, and which is a social indicator. Then we can see health indicators that people living with limited long-term illness. And then we have a risk factor for poor health, which is obesity in adults. So these three measures are very correlated to each other. And we can see as we map the weak areas, weak in terms of the bottom 20 ranked areas based on our urban health index methodology, we can see that the worst performing areas colored in red almost overlap. A lot of them are in the top right side of our neighborhoods. There is a few at the bottom. And Anna, if you can click on there, we can see that the one that turn in red are the areas they overlap. So 16 out of the 20 poor performing areas perform poorly or in the bottom 20 for all the three social outcomes. We do know also from analysis that these areas also have high level of deprivation, poor levels of income, which if you work in health or anyway, you probably do know that poor level of income and deprivations affect our health outcomes. Following this, we started thinking in a different way. We start thinking about, do we know if areas that got a similar level of income, but they do have very different health outcome? So if we go to the next tab, Anna, thanks. So we looked at, we actually organize our neighborhoods into income bins, and we color our neighborhoods based on the performance scoring system for health and wellness. So the health and wellness, if you saw it before in the scorecard, but if you have time, you can go back to that, is the component that is built out of 4 health outcomes, which we selected because we thought they were mostly relevant for our programs. So the health and wellness component is made of asthma prevalence, depression prevalence, diabetes prevalence, and female healthy life expectancy. So we can see from this chart, so we've got these lines going to 2 neighborhoods, Lambeth South and Borough and Southwark. These 2 neighborhoods are in the same income bin, so they have a similar level of income, but they are performing very different from the health and wellness outcome. So one is in the top 20, which is Borough and Southwark, which means they experience quite good health, and Lambeth is actually in the bottom 20. So if we look at the next chart, we can see actually they are really at the opposite end for the health and wellness score. So we have Lambeth South, which is 67 out of 68, and Borough and Southwark Street is second out of 68. But they have a similar level of income around the £27,000. So at this point, we start asking ourselves, what do we know more about these neighborhoods? What is affecting the health outcomes? And how can actually we affect the health outcomes? How we can improve the health outcomes with the work we do? So if we go to the next one, we're going to look at the scorecards. So it's a bit slow because it's refreshing the data. So if you can select here, Anna, let's look at Borough and Southwark in the scorecard. So Borough and Southwark has got a big red dot at the top, so which means it's performing in the bottom 20 for the urban health index, the total index. If we look at the scorecard, we can see that has got a red score for personal safety, is in the bottom 20 for also environmental quality. It's not a surprise, it doesn't come as a surprise if you look at the map where this neighborhood sits is top of our boroughs, is near the river, where there is a lot of access to transport stations, therefore there is a higher level of air pollution. Also probably is where the nightlife is, therefore probably a worse level of personal safety in terms of number of crimes and safety. But it does have a really good score for health and wellness. And we can see also that when it comes to community needs, there is low level of community needs. So let's have a look at the scorecard for Nanette now. That one, yes, I can't see properly, it's very blurry, my screen, Anna.
Yeah.
Okay, so Nanette South has got a green urban health index, is in the top 20 because it's in an area which is not highly polluted. There is no high level of crime, but it does have a poor outcome for health and wellness. And that's where we start asking ourselves where we can help to improve this outcome. And if we look at indicator under inclusiveness, which is the one in red, yeah, if you can point out, yeah, up there, perfect. We can see that has got a very low levels of participation in community life. That indicator is actually community needs active and engaged score, which has been built by the Oxford Consultants for Social Inclusion, and it measures the levels of third sector civic and community activity and barriers to participation and engagement. So it shows whether there is charity active in the area, if people appear to be engaged in the community life. And if we go to the next tab, Anna, we can see that the two neighborhoods that we looked at when we started the analysis, so I've got the same level of income, but I've got a very different health and wellness outcome. They also have a very different level of community engagement. So Borough and Southwark is second, it's got a high level of community engagement, and Nanette has got a poor level, is in the bottom 20. And that's where our charity or our organization can help, because one of the strands of our multiple long-term condition programs is the neighborhoods. Our multiple long-term condition programs is working in trying to slow down the progress from one long-term condition to two long-term condition or multiple long-term condition. And the strand we work in are home, money, work and neighborhoods. We do know the neighborhoods where there is a high level of engagement from the population and a high level of community lives, people can help each other, people have better health outcomes. There is a lot more we can do with the Urban Health Index, with the indicators we use to build the index, with the components. This is just a start. We only published it a few weeks ago, so there is more to come. Anna can talk to you about what's next, and then we are going to have questions. And thank you.
Thanks, Alessandra. So what's next? So as Alessandra alluded to, we feel that we've really only just started kind of scratching the surface of this. So we published it early April. And as I mentioned before, we've kind of updated the scorecard. We think it's much more valuable, including that map. And we've started to do some analysis. So the idea is that we'll kind of to publish, provide those updates. We want this tool to be very easily accessible for people to use. So we'll be publishing some updates. We'll be continuing to explore the data and try to extract new insights going forward. And we're trying to start to get people to it. So we're doing some external information sessions as well as internal sessions to really get people engaged with it. And obviously through that, we really want to collect feedback on how the tool is being used and who is using it. And finally, the idea is that this will be refreshed year on year so that we can really track progress in our boroughs over time. So that's the idea for next steps. I there and we can to questions if anyone has questions. Okay, so maybe I'll stop sharing. Let's see. Okay, so we have questions in the chat. Kat Walker, did you include subjective measures of well-being, such as happiness? We didn't. There were considerations for using some of these types of indicators, but we didn't have at the granular level that we were interested in. We didn't have it at MSOA level or a more granular level. It was really hard to in the index. So that was a big limiting factor, I think, for a lot of the indicators we would have loved to use. But very good point, of course. Do you capture the data users who access these scorecards? Alessandra might know that. Do we know who you have records of who's accessing, Alessandra?
We can count the number of people that are accessing the scorecards, but we do not know who is accessing the scorecards as such. But we have a way to identify the users within our organization. So if the scorecard is used by people that work with us, we do know who is using it, but not external.
Yeah, so I think we're trying to engage kind of more personally with external people so that we can get that feedback of who is actually using it and how. But I think we just have, as the numbers in terms of external usage.
It could be a good idea, actually, this one, in terms of how should we find a way to capture feedback. Thank you.
Do you work with the folks at Urban Big Data based in Glasgow? I don't think we have worked with them. I more and look more. I don't think we have in the past.
Oh, I can see.
If it for another urban area, would it be possible to create these scorecards for the area? The data that we used is available across England. So using the tool Local Insight, a couple other sources of data. So it could be replicated at other areas. I will say that other local authorities have done this. So Barking and Dagenham have an SPI, and I believe Surrey is creating as well. So if you are interested in doing it for a different area, get in touch with us. I'll put you in touch with the Social Progress Imperative, who are great partners walking you through the process so that you could make it as relevant area as possible. Ooh, pricey is access. Alessandra, do you know this for local?
So the best person to answer the question would be probably the OCSI team, but it is worth the price. It's not expensive, but it reduced the amount of work we had to actually do to build the urban health index. If you think about it, probably 95% of the indicators we use to build the urban health index are in local insights. And other things I should point out, the data in local insight goes down to LSOA level. So it is extremely, granular. So if you want, Duncan, we can kind of email you a contact from the OCSI team, and you can have a chat with them.
Yeah. That was the reason for MSOA rather than LSOA. So we did consider LSOA at the very beginning. I think for us, we wanted to have, wanted to have granularity, but we also wanted it to be meaningful. Talk about kind of neighborhoods, it's usually at more of an MSOA level. So it's hard to say LSOA number has this kind of indicator, is this score. And internally, we often use MSOAs to kind of target projects. So for us, it felt more relevant, but it also felt like it would be more helpful when talking about to do it at an SOA level.
I should also mention that most of the health outcomes do not come at LSOA level. They don't come at the granularity. So, and because our index is really health related, we had to use a geography that we did add data available for.
Yeah. I don't see any more questions coming through. Please add if you have. I haven't checked the.
So Anna, should we put a link to our index, or did you put it at the start? Sorry, I missed the first few minutes. So
that's okay. Yeah, no, I haven't. That now, so I'll put the links to the scorecards on our website, which has also the methodology report and the data. So if you wanted to download the data yourself, we've included that. I will find a way to send the PowerPoint as well. I know someone asked about that as well.
I'm going to also share, since you've been asking, the link to our OCSI, local insight page, the one we created for our borough. Shall I?
I think someone just published the OCS.
Oh, they did. Okay. Oh, I can see.
Kate White.
Yeah, thank you. Thanks. Fantastic.
Perfect. Let's see. Oh, one more. Was one of your more important criteria to include indicators that are frequently updated? So that was one of our criteria, was how recent is the data? So we really tried to avoid census. Unfortunately, it's hard to avoid completely, so there are some census indicators in there and other data that we didn't think would be updated at a regular frequency. So we tried our best to avoid it. Of course, with open data, you kind of have to take what you can get, but we use that as a criteria to avoid as much as possible.
There's no more questions here.
I don't see any more questions, but if you do have any questions, we can provide I think our details are somewhere. Are our emails anywhere? I can put our emails in here. If you have any follow-up questions.
We can publish the presentation and then share. Duncan asked if we can share the presentation. I think we can publish in Tableau public and then share the link easily.
Okay. Yeah. So hopefully we can do that through the data. Yeah. Cool. I guess we'll leave it there. thank you for coming. Thanks for your attention, and we hope that the Urban Health Index is useful for everyone. And hopefully we'll be in touch with some of you.
Thank you, everyone.
Thank you. Thanks, everyone.